My name is Dr. Hazel Keedle, and I'm a Senior Lecturer of Midwifery, and I've been the Director of Academic Programmes for Midwifery at the School of Nursing Midwifery at Western Sydney University. I've been part of the integration of the oral health module into our first subject that our Bachelor of Midwifery students do, called Midwifery Knowledge 1. I was a subject coordinator for this subject when it needed a bit of an update, and I did notice that the information that we had main on oral health was not always included in that subject. So I reached out to AGESH and said, let's update this. We created an interactive book using H5P with updated lectures and information, and then embedded this into the online content for the students. The students have online content and tutorials, and there's 1 week where it's all online content. So we popped it in that week to ensure that the students had some really interesting content to help them along this journey in understanding oral health. In the interactive book, there were also guided questions. So they would go through all the information, and then they would need to answer the questions one by one to show that they have understood the learnings. This was then tested again when they had their final exam, so that we know that they had to revise this information as they knew that it was important for the exam. We also then had it in their corresponding practical subject called Midwifery Professional Practice 1, where in their tutorials, they would do a very simple oral health assessment on each other. This is something that has been introduced, although there are some challenges with that because that subject is often led by sessional staff and it's not always consistency. However, from last year, we had a permanent staff member working in that subject, and we are looking at how we can expand that to ensure that every class has that oral assessment. As the Director of Academic Programmes, I've also led a re-accreditation of our Graduate Diploma of Midwifery, which is for the registered nurses to become midwives. The oral health component wasn't part of the curriculum that I was revising, so I embedded it within the perinatal care subject that covers everything from antenatal, labour and birth, and postnatal over an entire semester. I've popped it in as an oral health interactive book like we have with the Bachelor of Midwifery, and they will also then do that in their practical class as well. Doing a accreditation takes time, so that subject will be starting for the first time in 2026. So it'll be really interesting to see how registered nurses actually adapt to this information and how they then use this, because they may have some other knowledge already about oral health. So it'll be interesting to speak to those students. Really enjoyed working on this content about oral health. It was a good revision for me back when, before I even became a nurse, I did do a few years working as a dental health nurse. So this was really interesting for me. We do have some challenges in using this, and that is the consistency across our staff, especially when we use sessional staff, and that might change each semester. But we do have plans to work on this, and we will work as a team because I know how important it is to get this information to students. The students' reactions are something we need to get a bit more information on, but it seems that they are really interested in this already. It's been in the Midwifery Knowledge 1 subject for about 3 years now, in the new format in the interactive book, and we know that they're having to revise it for their exams as well. I'm particularly interested to see what the registered nurses doing their midwifery think about this program, and how they then use it in the practical scenarios as well. It's been really interesting working with our team with this, especially our new subject coordinators, as they're learning this new content, and it may not have been something that was covered in their initial training to begin with. But we do know the benefits of it thanks to the fantastic research that has been done, and we know the importance of this for midwives. So we can see the benefits within our students and within our staff, but I think this will only just grow as we have embedded it into different programs.